Module 5, Resident and Family Engagement. The Resident and Family Engagement module of this toolkit focuses on the roles and responsibilities of the resident and family as a member of the facility safety team. Engaging the resident and family as partners will help assure they can be active participants in their care and in the decision-making process and understand how the facility is using resources to reduce harm and improve safety. In this module, we will define resident and family-centered care, describe the key concepts of resident and family-centered care in long-term facilities, explain the importance of engaging residents and family members to improve the culture of safety, describe different methods to engage residents and family members in safety initiatives, especially in the area of reducing infections due to urinary catheters. Discuss the variety of roles and how each role can contribute to improvements in quality and safety. Let's discuss resident and family-centered care. The Advancing Excellence campaign describes resident and family-centered care as follows. Person-centered care promotes choice, purpose, and meaning in daily life for residents in a long-term care facility. Person-centered care means that nursing home residents are supported in achieving the level of physical, mental, and psychosocial well-being that is individually practicable. This goal honors the importance of keeping the person at the center of the care planning and decision-making process. Care plans are living documents that are revised to reflect a person's changing needs. In person-centered care, staff places a premium on active listening and observing, so staff can adapt to each resident's changing needs regardless of cognitive abilities. The person in long-term care facilities is the resident and their family. Family is defined by the resident. Residents, whenever possible, determine the extent to which family are actively engaged in their care decisions. In person-centered care, resident preferences or past patterns form the basis for decisions around a resident's routine. The core concepts of person-centered care as defined by the Institute of Patient and Family-Centered Care include dignity and respect, information sharing, participation, and collaboration. Dignity and respect. Healthcare providers listen to and honor resident perspectives and choices, resident and family makeup, knowledge, values, beliefs, and religious and cultural background. All these variables are incorporated into care planning and delivery. Information sharing. Providers share complete and unbiased information with residents and families in ways that are easily understood and address concerns or questions. Residents and families receive timely, complete, and accurate information to participate in care and decision-making. Participation. Residents and families are encouraged to participate in care and decision-making at the level they choose. Collaboration. Residents, families, providers, and healthcare leaders collaborate in policy and program development, execution and evaluation, as well as in facility design, professional education, and care delivery. Specific actions that demonstrate person-centered care can be described to help nursing homes improve the quality of care and life of residents. Eliminating the assembly line approach to care and embracing a philosophy of residents as individuals are key characteristics of a resident-centered facility. Facilities should strive to accommodate resident choices and preferences as one way to support the resident's ability to achieve the best and safest quality of life possible. The key to person-centered care is considering that no decision about the resident should be made without asking, have the resident and the family participated in this decision? If the answer in this question is no, then the next step should be to find ways to include the resident and family in their own care decisions. Examples of resident choices that help demonstrate person-centered care include choosing meal times, expanding activity choices, choosing bathing preferences, supporting residents occasionally refusing medications or avoiding dietary restrictions, encouraging families to bring familiar items from home to decorate the residence space, and inviting residents and families to participate in care planning meetings and in safety and quality improvement education and discussions. It is also important for facilities to educate and empower staff so they can effectively engage residents and families as partners in safety. Efforts to collaborate with resident advisors, advocates, and ombudsmen are other ways facilities can demonstrate a commitment to resident engagement. Person-centered care is different from the traditional care model. Care of residents in long-term care settings was originally designed around a medical model. This traditional model is similar to care delivery in a hospital, where care is driven by diagnosis, care tasks, and the individuals who perform the tasks. In the traditional model, management staff frequently make the decisions, with minimal input from frontline providers and without much personalization based on the individual's needs. Some long-term care facilities are using a model that demonstrates person-centered care. In this style of care, the resident and family are actively engaged in their own care. Residents and family are encouraged to be as engaged as the resident's condition allows them to be. The culture at a person-centered facility promotes the philosophy that each person has the opportunity to participate knowledgeably and effectively in their care. This slide provides specific examples to help staff understand the differences between the two models of care. Many nursing homes deliver care that reflects characteristics of both styles. A person-centered approach provides many benefits for residents and families. The benefits for residents and families include having personal autonomy and the ability to direct care, being offered choices that foster engagement and improve quality of life, living in an environment that promotes trust and respect, collaborating with staff who are attuned to resident preferences and needs and who will respond appropriately to the residents' preferences, the opportunity to achieve the best quality of life possible. Person-centered care can also have a positive effect on the staff. Staff working in person-centered facilities state they are able to establish more meaningful relationships with residents and their families. Staff have a greater sense of satisfaction when they are encouraged to understand resident preferences and anticipate and respond in a timely manner to resident and family needs. Staff experience increased efficiency when a facility lets them dedicate time to issues that are important to residents and families. In a resident and family-centered culture, staff recognize that they are an essential part of the organization and that their work is highly valued. Long-term care facilities that support resident and family-centered care report a number of benefits, including improved quality outcomes due to staff's ability to quickly identify and respond to residents' needs, increased referrals as a result of positive recommendations, and decreased staff turnover and increased staff satisfaction. Many tools have been developed to help leaders and staff assess how well the facility demonstrates the principles and practices of person-centered care, especially as it relates to understanding resident preferences. These surveys provide useful information that can be used to improve performance in resident and family-centered care. The next few slides will focus on defining resident and family engagement and providing specific examples of how to engage and partner with residents and family members. Resident and family engagement is an important component of person-centered care. It involves the entire team working together to create an environment in which every team member, including the resident and their family, can work as partners to improve healthcare quality and safety. Residents and family members are valuable members of the healthcare team who offer a unique perspective on the care provided in a facility. By engaging residents and family members as partners, a facility is able to leverage the skills and knowledge of all team members. Resident and family engagement supports a variety of improvements, including enhanced resident and family satisfaction, improved clinical outcomes, and improved staff satisfaction. These improvements occur as a result of engaging the unique perspective of residents and families in all decision-making. Staff can create a culture of resident and family-centered care in a variety of ways, including establishing positive relationships with residents and family, focusing on the needs and preferences of individual residents and family, encouraging resident and family participation in all decisions, and communicating that resident and family-centered care is a priority at all levels. A resident and family-centered care culture requires the support from all staff and the demonstration of the principles and practices throughout the facility. Establishing trust and a relationship is the first step in engaging with residents and their families. When meeting a resident and family, introduce yourself by name and role. Let them know how you are involved in the resident's plan of care. Ask how the resident and family member would prefer to be addressed, and allow time for the resident and family to ask questions. AHRQ developed a tool to help residents and family members get to know the healthcare team. Consider sharing this with residents and family members so they feel more comfortable with all team members. Family members have a strong investment in the care and health of their loved one. It's important to listen to their concerns and work with them to develop an individualized plan of care. Watch this video to see a demonstration of staff listening to the concerns of a family member.
Lisa, do you have a minute? I need to speak with you about Miss Matthews in room 355. Her daughter is really upset.
Really? Mrs. Matthews' daughter, Kathy, is always so friendly to everyone. What's the problem?
She was almost crying. She's worried about her mother's incontinence and the smell in her room when she arrived for her visit today. She asked if her mother could have a urinary catheter. I told her I'd talk to you about it.
Well, we don't put catheters in residents unless we have a valid medical reason, and urinary incontinence isn't one of them. I'll be down in just a minute to talk with her.
Okay.
Understanding resident preferences is also an important part of establishing relationships with residents and family members. Is frontline staff supported in discovering the likes and dislikes of residents? Do staff have the authority to do something about residents' preferences? Are staff members allowed time to sit with residents and have a meaningful conversation, or do an activity together, such as eating lunch or joining them in an activity? What are some ways you have tried to understand resident and family needs and preferences in your facility? Residents and family members should be encouraged to participate in the planning and development of care plans based on the needs, preferences, and abilities of each resident. Residents and families should be given access to relevant healthcare information in ways that the resident and family can understand the information. Staff should be encouraged to listen to, incorporate, and document resident and family preferences in the resident's plan of care. Watch this video to see a demonstration of staff addressing family concerns and including these concerns in the resident's care plan.
Hi, Miss Matthews. I'm Lisa Cranford, one of the nurses who cares for your mother.
Yes, I remember you.
It's good to see you again. Alexa mentioned that you had some concerns. Why don't we step over here while your mother's resting?
When I first walked into her room, it smelled terrible. It just makes me so upset.
I completely understand. We've cleaned your mother and she no longer has an odor.
I don't want this to happen again. With her dementia, she doesn't remember to use the toilet. I want you to put in a catheter.
Well, Miss Matthews, we don't use catheters unless they're medically necessary, and urinary incontinence alone doesn't fit the criteria.
What do you mean not medically necessary? She's wetting herself.
I can understand that you're upset, and you're raising an important concern. How about if we work together with our nurse manager, Barry Woodman, on this? We can all sit down and discuss what to do together. How does that sound?
That sounds good. I like the services this nursing home provides, but this is just so upsetting. Mother would be so embarrassed if she could understand what was happening.
Let me contact Barry and see when he's available to meet with us, okay?
Clear communication is vital when enhancing resident and family-centered care. Effective communication begins with listening to the resident and family. Listening to the resident and family can be demonstrated by using open-ended questions, acting on what the resident and family say, helping residents articulate concerns, getting a translator if needed to support the communication, and sharing resident preferences with everyone on the care team. One of the most important and challenging parts of engaging residents and family members is communication about health concerns, care plans, and next steps in their care. These can be difficult conversations, but it's important to take every opportunity to engage the resident and family members by providing timely, accurate information, ensuring that the resident and family member understand the language you are using, and allowing plenty of time to ask questions. In the following video, a resident's daughter, CNA, nurse, and a nurse manager have a conversation about the care plan and next steps. Watch this demonstration of how staff engage family in explaining care plans.
Thank you for coming back to meet with us, Kathy. This is our nurse manager, Barry Woodman. I believe you've met before?
We have. Good morning, Ms. Matthews.
Good morning.
Ms. Matthews, can you tell Barry about your concerns with your mother?
Sure. My mother took a lot of pride in her appearance. If you'd known her before, she wouldn't have wanted to smell like this. And it can't be good for her. I didn't think that this was the kind of place that let people sit in their own pee.
And we're not, Ms. Matthews. And I apologize that your mother wasn't cleaned up more quickly. I also want to let you know that the first thing I did after we spoke was to talk to the doctor to see if there was a medical reason for her incontinence. Unfortunately, there's nothing we can do to prevent it.
So why can't she have a catheter? My friend's mother, who's at a different nursing home, has one.
Well, catheters are very useful when they're medically necessary. For example, I know that your mother had a catheter last year when she was admitted to the hospital due to her condition. It's not a good idea to leave them in for a long period of time.
Why not? She needs one all the time.
Well, Ms. Matthews, if we were to leave a catheter in your mother, she'd most likely get a urinary tract infection.
Infection? That would not be good, especially at her age. But aren't there antibiotics to treat infections?
Yes, but antibiotics have drawbacks. They kill both good and bad bacteria, which would make your mother susceptible to other infections that could give her symptoms like diarrhea.
Oh, that would be awful.
And there's also the danger of the bacteria becoming resistant to the antibiotics if they're taken when they're not necessary, which make infections harder to cure. We just don't like to use antibiotics if they're not necessary. And there's other problems with catheters. If your mother had a catheter in, it would be harder for her to move around, or she could pull on it, and that could be very painful, or it could cause her to trip and fall, and, well, we certainly don't want that to happen.
I appreciate that you're trying to keep my mother safe. But I can't sit here and tell you that I'm okay with her smelling the way she did. I mean, her whole room smelled terrible.
I agree, it did smell in her room.
Well, maybe we can try a more absorbent adult diaper, one that's going to ensure less leaking.
But I still want her changed whenever she's wet. I don't want her to go so long between changes.
Yes, you're absolutely right. We will change the schedule so she's checked more frequently. And I can see that you're still not comfortable. There's something else we can try.
What's that?
We can try and get your mother set up on a toileting schedule. We'll start by observing the times of day that she generally needs to go, and then we'll set up a schedule based on her routines.
But she doesn't always speak up when she needs to go. How will you know when she needs to go to the bathroom?
People can get used to going to the bathroom at certain times of the day. The nursing assistants will take your mother to the bathroom when she's used to going, and then it becomes a habit. Many of our residents, like your mom, have memory issues, but we've been successful at creating a toileting schedule that works for each of them.
Okay, but here's my concern. I trust that Lisa and Alexa will keep to the schedule, but they're not always here, and neither am I. What then?
Well, we appreciate your trust in them, and they're great members of our staff. But here's how it'll work. We'll write your mother's toileting schedule into her care plan. Every staff member who oversees her care will refer to that plan. They'll know when to take her to the toilet.
And Ms. Matthews, we have meetings during shift changes to ensure oncoming staff are aware of any changes in a resident's care plan.
Ms. Matthews, why don't we give it a try? We'll schedule a meeting in a few weeks so we can check back and make sure that your mother's new health care plan is working.
That sounds good. I really appreciate that. Thank you.
Of course.
Thank you.
In addition to communicating about care plans, residents and family members should be aware of any changes that might be implemented in the facility, such as changes to policies, schedules, or the implementation of safety programs that might affect the care a resident is receiving. Residents and family members should receive information concerning why these changes are being made and how these changes can impact staff, the resident, and the family. It is also important to share that change can be difficult and that all improvements involve some change. The following are questions you and all facility staff should be prepared to answer about any changes that may be implemented in the facility. There are many ways to communicate information, including changes, to residents and family members. Some of the most common tools are newsletter articles, posters, town hall meetings, resident or family council meetings, care conferences, individual meetings, and local newspaper or TV news stories. There are a number of other ways that facilities can communicate important information, including ask frontline staff to introduce the project through word, song, dance, drama, etc. Put explanations in bills or other family or resident mail. Ask your governing board to do a presentation. Use graphics and charts to provide support for visual learners. Create talking points so all staff can answer simple questions about the project. Leaders and staff may find it helpful to use a list of resident and family engagement practices to guide their efforts. This checklist was designed to provide leaders and staff a simple tool to help plan, implement, and evaluate resident and family engagement in safety projects. The tool can be used by leaders, LTC facility administrator, director of nursing, medical director, etc., and any staff who provide care or services. To use the checklist, first review each task and decide which activities may already be underway in your facility. Then, add additional activities or expand existing efforts to enhance engagement of residents and family in your facility. Communication and engagement with residents and family members can be challenging for a number of reasons, including language differences, health literacy levels, or health complications like dementia or loss of hearing. It is important to recognize these challenges and implement methods to address each challenge. A few methods you can use to address communication challenges include: ask how the resident and family prefer to receive information. If the resident is hard of hearing, does the resident have hearing aids that work, and does the resident use their hearing aids? Use face-to-face communication to promote visual contact. Use written materials that provide useful and relevant content based on the resident's needs and preferences. Plan to repeat information using multiple interactions and formats as needed. Use teach-back methods to confirm understanding. Additional strategies and tools for communicating with residents and family are located in the Teamwork and Communication module. Some facilities have engaged residents and family members by designating residents as advisors. An advisor can be a current or past resident or family member who has agreed to provide their input and perspectives to help improve processes and care at your facility. A resident and family advisor offers a unique perspective on the care provided at the facility and can be a valuable team member on safety and quality committees. It is important to recognize that a resident and family advisor is a partner and team member when developing facility policies, procedures, and practices. Some facilities may use a formal process, such as an application and interview process, to invite resident and family advisors to serve on committees. Remember, effective advisors want to improve experiences for other residents and family members and help facilities improve quality and safety by giving meaningful input and feedback. Residents and their family members are ready to become advisors when they are willing to talk about their experiences constructively, ready to work with people from different backgrounds who have different viewpoints, and willing to be discreet about the information they receive. Residents and family members who are interested in becoming advisors can refer to the Am I Ready to Become an Advisor tool, which is included at the end of this module. Once a committee chooses a resident and family advisor, the committee leaders should work to create a safe, considerate environment for the resident and family advisor to share his or her experiences and opinions. It is helpful to prepare healthcare professionals who will be working with advisors by explaining the advisor's role, contributions, and expectations for involvement. The committee leader may also need to help the resident and family advisor learn ways to express the concerns of residents and families while being respectful of the healthcare staff. Facilities interested in identifying resident and family advisors should consider asking advisors who represent different cultures and those who do not speak English to assure a variety of perspectives are secured. If the facility chooses a non-English speaking advisor, the facility should access a medical interpreter to support the needs of the advisor in meetings. Advisors can also help facilities identify changes that matter to other residents and family members and recognize the impact of changes in the facility on staff and residents. Advisors can effectively collaborate with staff to develop resident and family-centered policies and procedures. Staff members should consider the opinions of advisors and consult with advisors prior to making decisions about resident experiences, care delivery, educational materials, and facility design. There are a number of desirable characteristics for a resident and family advisor. Below is a brief description of each of these characteristics. When selecting advisors, think about these and other characteristics that can help assure success for resident and family advisors in your facility. Listen well. Effective advisors are good listeners. They listen to the questions staff ask and provide respectful, honest feedback. Advisors work with physicians, nurses, administrators, and support staff to ensure their contributions are received. Staff may use active listening and repeat back to validate that the information the advisor is trying to convey is understood. Share views. Resident and family advisors are open to sharing their experiences with facility staff. They provide constructive feedback and focus on how to prevent a problem from recurring rather than just focusing on what happened. Effective advisors are balanced in their positive and constructive input. Communicate effectively. Effective communication ensures the best outcomes from meetings with the facility staff and advisor. Making sure everyone understands the ideas being discussed will contribute to successful meetings. Ask questions. Resident and family advisors need to feel comfortable asking nurses, physicians, and administrators questions, and the care team should feel comfortable asking the advisor questions. Expect disagreements. Advisors and facility staff should be prepared to resolve disagreements respectfully and not take others' opinions personally. Facility safety teams can involve resident and family advisors in their work by inviting 2 or 3 residents and family members to a team meeting to discuss their facility experience, asking residents and families to give feedback on educational or informational materials, inviting residents and families to present at staff orientations and in-service programs, exploring the facility through the eyes of residents and their families by doing a walkabout with residents and families. These informational, thought-sharing activities will help facility staff gain a better understanding of the needs and attitudes of residents and their families. Resident and family advisors can offer insights that are different from the facility staff's. They help the team develop new priorities and innovative ideas that contribute to delivering high-quality, resident-centered care. Watch the video to see how this facility learned from an interaction with a family member who had a concern. We can learn a lot from the experiences of resident and family advisors.
Well, last week we learned about debriefs at our team steps training. Let's talk about how that conversation went. What do you think went well?
Ms. Matthews was comfortable enough to speak up. She shared her concerns with all of us.
I agree, Alexa, and thanks for bringing Ms. Matthews' concerns to me. If we weren't all working together to solve this issue, it could have caused her to become frustrated with everyone caring for her mother.
Lisa's right. Alexa, thanks for bringing Ms. Matthews' concerns forward. So, any other thoughts on what went well?
I thought we made her feel welcome and like a member of the team caring for her mom. And I thought you set a good tone for the meeting, Barry.
Well, thanks, Lisa. I agree. It felt like a comfortable conversation. So, what did we learn?
I learned a lot about Ms. Matthews' concerns related to her mom's sense of dignity.
I think that we also learned when we explain things clearly, people understand why we do what we do. Once we explain the risks associated with using catheters or possibly using antibiotics, Ms. Matthews actually agreed that those were things we all wanted to avoid.
I think Ms. Matthews thought a catheter would be an easy answer, but it sure can create a lot of potential problems.
So what can we do differently next time to make conversations with residents' family members even better?
I think that Ms. Matthews was pretty brave to come by herself and talk with us. We should have mentioned that she could bring somebody with her. I think that we should offer families the option of bringing more than one family member to join these types of discussions.
I think it'd be great to include the resident, at least for part of the meeting, to find out what she prefers.
That's a great idea, Alexa, although it depends on the cognitive function of the resident. I think we had a productive discussion with Ms. Matthews today. But we also need to be thinking about preventing resident issues that cause family distress in the future.
I think there are other residents who have the same problem Mrs. Matthews does.
I agree. How about I work with the nurses to identify other residents who could benefit from a toileting schedule?
That sounds like a plan. Let's talk about it at our joint staff meeting next week. Thank you, both of you.
There is also a national program that supports the role of Long-Term Care Ombudsman, LTCO. The LTCO serves as an advocate for residents of nursing homes, board and care homes, and assisted living facilities. The Ombudsman program was created in 1972 as a public health service demonstration project to meet the needs of residents facing problems in nursing homes. There are long-term care ombudsman programs for each state, as well as networks of regional or local programs. More information can be found on the National Long-Term Care Ombudsman Resource Center website. Ombudsmen provide information about how to find a facility and what to do to get quality care when residing in a long-term care facility. The LTCO are trained to resolve problems and to help residents and families resolve specific complaints. The resident and family members must give the Ombudsman permission to share their concerns. Otherwise, resident and family complaints are kept confidential. Under the Federal Older Americans Act, every state is required to have an ombudsman program that addresses resident complaints and advocates for improvements in the long-term care system. In summary, a long-term care ombudsman resolves complaints made by or on behalf of residents of long-term care facilities, educates consumers and long-term care providers about residents' rights and good care practices, promotes community involvement through volunteer opportunities, provides information to the public on long-term care facilities and services and legislative and policy issues, advocates for residents' rights and quality care in nursing homes, personal care, residential care, and other long-term care facilities, and promotes the development of citizen organizations, family councils, and resident councils. Resident-centered care and effective engagement among residents, family members, and care providers improves health outcomes and resident and family satisfaction. Organizations should be prepared to partner with residents and family members to improve care and ensure clear and open communication among all team members. Advisors and long-term care ombudsman programs can provide valuable insight and perspectives to support resident safety and exceptional experiences for residents and family members.